This is the most important thing to the people know it. And hijama is not a painful procedure. Same what we are talking before. It's a tickling, just a tickling in the street. It,
Welcome to our Healing Hours podcast. This is your host, Dr. Sneha. And today you're going to have a real treat with our doctor, Dr. Haiman El-Nahal. So, welcome, sir. Welcome to our first podcast. And I would love to start it with you because you are my teacher and everything in hijama. So,
I'm happy to be with you in the first place.
I look wherever I see hijama, my target is my role model is only I've always seen your videos, your page is filled with so much of information of each and every single disease. Alhamdulillah. So we are meeting second time after my teaching session.
Yes, after the course,
Yeah.
you are smart in the course, right?
Thank you. I appreciate it. So sir, I just want to ask you that why have you chosen hijama as a profession?
This is a very nice story. You know, I'm a GP practitioner since I'm graduated from the medicine college, and I start to see the patients, especially in internship. But we start also to listen about the complementary medicine. You know, when we are students, especially, we are interested in one object, which is the modern medicine.
Exactly.
But I saw a lot of the result. I visit a lot of the country. I saw the people treated by this type of treatment. No. Then I'm thinking about what kind of treatment we can integrate or how to integrate modern medicine with complementary medicine.
Exactly.
And this is my object in this time. Then I choose especially hijama because I saw it a lot of a good result to the patient, especially when we are going for the treatment hijama. If you are doing it in the professional way.
Right,
See,
right.
that's the most important.
That's really most important thing right now. Because people think hijama is something, they think that there are many questions from patients, like points that it should be more blood should come out. It should be a massage before that. But there are so much of misconception people have gathered in their mind.
This is the most important thing, and like that broadcast, a lot of media
Yeah.
to sharing a good knowledge about the hijama because the people say what you said, they have a misknowledge,
Yes.
misinformation. Especially the people talk, there is bad blood, there is no bad blood in the human. Hijama is not to remove a lot amount of blood. Hijama by scratching the skin and waiting the reflex on sympathetic and parasympathetic nervous system.
Okay.
This is the most important thing to the people know it. And hijama, it's not a painful procedure. Again, what we are talking before, it's a tickling, just a tickling on the skin. A lot of people said, I have a scar from hijama. This is misuse of hijama.
Okay. That's really informative. Yes. What you can portray, like what is hijama to people, how they should accept it in today's world with modern medicine. Like, people are having so many treatments out here.
Yes, that's a good question because as you know, hijama is type of complementary medicine.
Yeah.
But the misuse is the most important thing. And the second, how to integrate with the modern medicine. We have a limit of hijama. We cannot sit hijama treat everything. This is not true at all. Hijama will help in some disease. Hijama, we can do it a good effect in the prophylactic way, especially to improve your blood circulation, increase your immune system, relax the mind, make a good health, especially for the people is unless it's make some exercise or without exercise. Because nowadays you see athletics, a lot of athletics do hijama and talk about with hijama also because in the hijama we talk about concentrate about with hijama. So of course we can integrate it, the hijama in the modern medicine in some level, especially in the chronic disease. We can do it for the hypertension patient, for diabetic patient, or the patient with autoimmune disease. But the most important thing is cure or help in the treatment.
Okay.
Answer, help in the treatment.
So that is the thing point. It
Yes.
is help in the treatment of the modern world.
Yes.
Like, as you said, chronic. Chronic word is actually, people are suffering with many of the chronic cases. Like, there is cancer, there are many other things.
You know, this is the most important also point because the people sometimes coming to you, I have hypertension.
Yeah.
I need to stop my medication. Of course not.
It's
no.
not a magic.
Yes, of course no. You need to integrate hijama with your case, with your health. Maybe you can reach to decrease the amount of the medicine. This is normal if the hijama work very well in the body. It's not, you cannot tell the lie. Hijama treat diabetic, hijama treat autoimmune disease. Of course, my answer, no. Hijama help in the treatment. This is also very important to people know it. As the rule from Ministry of Health here in United Arab Emirates, and you know the advertisement, especially medical advertisement, must be licensed from the ministry and the authority. It's not allowed to say hijama treat, hijama help in the treatment.
Help in the treatment. So that is the right word, helping the treatment.
Yes.
Yeah, true. That is absolutely right.
This is the way the people to know about the hijama. Because you know, you concentrate about the most important thing, this use, this knowledge of the people. Some people thinking in the bad way, I can do it hijama, I can stop my medication, I can do hijama, I will treat my case in one session. It's not a mission.
Yeah, people are expecting magics in every session.
Yeah. Yes.
So, sir, what do you think that how many sessions of hijama in a year a person can take?
Okay. This is, we can divide it in two ways.
Oh.
If we don't complain of anything and do it as a prophylactic, we can once or twice a year.
Once or twice a year. Okay.
But if you are treat, and here between two column, treat the disease or help in the treatment, you need to put the program. At least we'll do it 3 tapping session in the starter.
Okay.
This is the first thing. Between each session, 1 month.
But
After that, we have many protocols. Sometimes every 4 months, the patient coming to you, or every 6 months, when we can do it like in fertility, 6 continuous session, because we need to make a good effect to the body. In this case, we can do it as a continuous treatment. This is the most important thing.
okay.
But the maximum 6 session we are do, especially in the infertility case.
Because there are many patients that, as you know, I'm also in the field of hijama and physio world. I have also heard like many patients coming and saying that, can we do twice in a month? There are people who are faking it like, yeah, we can do twice a month.
Sometimes they're very, this is a business way. This is a business way, because also the more I'm thinking about it. If you do hijama every week and you scratch the same point again,
Yeah.
then this point or this point heal within the week, others when doctors know. And if you need to scratch the same point, that means you increase the healing time.
Right.
That means the scar will appear. That means you scratch the skin again at the same point. This is all the effect the wrong way. What we are recommended, because we are still in the starter, what hijama is a reflex. After you put the cup on the skin,
Yes.
suck the skin, and then we'll start to scratch.
Yeah.
Then you are waiting something from the body.
Yeah. Exactly.
This is what we are needed in hijama. We are waiting something from the body. This is the reflex between sympathetic and parasympathetic nervous system.
This is ongoing one.
That means I need to wait.
Yes.
How it will get the result after 5 hours or 1 day or 1 week. Give it the time to the body to heal, and you get a good reflex.
Exactly. Means the body itself has to heal.
Yes.
Yeah.
Yes, this is what we call, this is the most important thing also in hijama.
Right.
Because when you are giving the body to heal, we give it a lot of the thing also at the same time.
Right.
About the nervous system, about the lymphatic system, the blood circulation, and also the general health of the body.
Yes.
Because that a lot of the people said, oh, after hijama, I'm feeling comfortable.
Comfort.
Yes, because the happy hormone is increased. But this is not coming with 1 second. Oh, you do hijama now, I'm happy. We'll go to jumping. Of course not. Of course not. At all, this is the misunderstanding with hijama. You need to wait. Especially sometimes if you complain of some issue, you need to wait to see the result. Yes. Passing this way, I need sometimes some of the vision.
Let's say, these patients, they say, oh, the blood is not there too much in the cup. That means, according to them, the hijama was not done well.
Yeah.
Okay. And some patients that, oh, I didn't feel pain when you scratch it. So I think you're not doing it the right way. You have to go more deeper.
Yeah.
So what do you have to say about it?
Okay. First, again, we'll share about this point. It's the myth, understand and myth.
Yeah. This really.
The hijama, not at all by the amount of blood. If it's amount of blood, طب why I scratch my very good 6 scratch between 9 to 13 scratch? Well, why would do that? You go to blood donation.
Exactly.
And with one puncture, I will take it to blood 450 milliliters, and that's it. And I donate. It's a healthy thing to my body. If like that, no. Hijama, it's not about the bleed, scratching, not about to remove a lot about blood, not about to keep the blood for long time and show to the patient. You see and get some clotting blood from the body. This is, of course, is not true.
Yes.
At all. Because what we are working it, working in the reflex inside the body.
Yeah.
Because that a lot of the people said hijama is improve immune system. Yes, it improve, but you know how? You don't know. No, what's improve? It's increase what blood cells, not like that. In our skin, you have Langerhans cell. Sure. When you are scratching the skin, you are activate this cell to more production of gamma globulin. This is what lead to improve your immune system and improve your health generally. That means by scratch, you can get this result. If you do this scratch, you will not get this result. If you do it superficial, also you need to do it a good scratch to get the activation or the reflex from the body.
So it is all psychological thinking that if I see this much amount of blood,
Mhm.
I'm happy. Or I get pain, I'm happy.
Mm.
That patient will, why do I do hijama? It's better like I can go and give my blood donation somewhere.
Yeah, but this is so is the big difference.
Yeah.
So that's also this information. That's true. I listened from some colleague, the doctor.
Yeah.
No, Hijama, it's like a blood donation. It's go to do blood donation. And why? I scratch myself. I do it like mine, scratching their cup and cup. It's like 49 scratch. Go for blood donation. First, you need to roll to the people, or to the people, or to the people. There is a big difference. First, in pajama, you remove the blood from the veins. The blood donation will remove the blood from the vein. The amount of blood in the blood donation 450 milli. Amount of blood in pajama 180 to 230 milli. When they remove the content of the blood donation, all the content of the blood and all the cells with the plasma is there. And the pajama, this amount of the cells and abnormal normal cells, but we have also normal blood cells like blood cells, but blood cell platelets, but this amount is disappearing amount of plasma. In hijama, when you do hijama, you can sit to relieve the pain because the production of the endorphin inside the body and the pain will relieve after doing hijama. In the blood donation, if you go to blood donation, there is no any change in the pain because there is no effect of hijama and the blood donation to the pain. The last and important thing, can repeat hijama after 1 month. You cannot repeat blood donation after 1 month.
Oh, that's really important. Yeah.
Related to the red blood cells.
Right. Right. It's that right. What have you like? What do you have to say about hijama in a religious way, like Sunnah days hijama and
Of course, Prophet Muhammad lived us to do it in 17, 19, 21 from the Hijri date.
we?
But when we are, a lot of the scientific people in the China especially see this related to the sea and the moon itself. And this is, the mind would be relaxed and the amount of blood be in the middle.
Oh.
But when we go for the Sunnah and we see a lot of the book of the Sunnah and Prophet Muhammad do it, a lot of the point also, he didn't for the point, he didn't do this book only in the Hijri day.
Oh.
Because if you are say now, Hijri date after like 3 weeks from now, and there's one patient coming to me, Doctor, I have back pain. I'm so sorry, waiting after 3 weeks and come to me. How like that?
Yeah.
So in the treatment way, you can do it in any time.
Anytime. Right.
In the prophylactic way, we are going for, as I told you from the starter, this is our religion, is a Prophet Muhammad recommendation. We can waiting for the Sunnah day, but hijama, we can do it in any time, in both ways, prophylactic and treatment.
Treatment.
Yeah.
Yeah, that's so nice to hear, Sada. Now we have spoken about hijab. So now let's. I want to know what are the basic especially for as an appeal. So let's talk with female thing. So in this world, we see a lot of stress.
That's
That is one part of life, and the other part is the feminine part, which is called period, infertility, and postpartum. That the depression comes. So will hijab help females to get a better lifestyle?
yeah. Again, when we do hijama in the professional way, we can get a good result. The female especially, because first of all, happy hormone. Second, with the ovulation is the most important things is to change the curve.
Ovulation differences.
And also increase and improve the healthy of the hormone. Because as you know, hijama will improve the hormone production and the balancing of hormone. Sometimes high TSH, sometimes below, sometimes lectin is high. Sometimes FSH, all of the hormone in the female, we can help in the treatment by doing hijama. Also regarding some instruction like ovarian Bavarian cyst, right, fallopian tube obstruction or cellular obstruction and fertility. Hijama will improve the health of the ovary itself because that the preparation of the uterus, if there's some pregnancy happen, would be more power and more better we do it hijama before like a 3 session at least or 6 session. This is related to the doctor and the situation. And also one important thing, a lot of the, especially the female, when we, who's not married, is single female, complaining of the pain during the period.
Yes.
When you do hijama, you will decrease the attack of the pain.
Wow,
Yeah.
that's so
Especially when you are do it as a recommended type of treatment. Better we recommended to do it, especially for the female, the third day after you finishing the period. If the period 5 days, of course, the contraindication to do hijama during the bleeding time. After that, we have 2 days rest. Then the 8 or 9 from the start of the period is the better day to do hijama. And the infertility and the hormone imbalance and any female.
we can avoid all painkillers.
I go because painkillers also have some side effect. I'm a doctor and I know the side of the effect of the medicine, but we don't have any other solution. You can add in the situation now like complementary medicine to integrate with each other to decrease the toxin and stuff in the body. And this is one of the aim of the hijama because there is no any type of the treatment in the world. You can extract something from the body and you get the benefit. All other type of treatment, you raise something to the third phase, you take it any medication, you take it cream, you take it IV drip, you take it subcutaneous, and you take it something races or something like that. But in hijama, you extract some amount of blood. This is will lead to get a lot.
So, if I'm not mistaken, I have heard this that painkiller also give you like obesity. You get fatter when you have too much of medicines, or painkillers. Instead of that, we can go to hijab. I mean, the thing you just said it. You just over in here.
But of course, doctor, we need to put some important thing to share and knowledge and some disease you need to take painkiller.
Yeah.
So, see,
You even think that you just keep on taking a painkiller.
the people sometimes adapt with headache. They'll take it a lot of the time painkiller. Because sometimes we reach the point the painkiller will not affect. This is what I'm recommended, and this is what we are how to integrate the both type of medicine. First of all, why we integrate to get a better health.
As we already spoke about females. So, in females, there is another thing also that, females are conscious with health, like overweight, hair fall, pimples on the face. So, as a female, that question also I have that will this help hijama in these?
Yes, I have two types of hijama here. I have what we call what we are talking about to improve circulation and decrease the skin vitality, and we have cosmetic cupping.
Oh, there is.
Yeah, cosmetic cupping is a type of dry cupping. Just we clean the face. We put some oil, like an argan oil, because it's very nice oil, and we do it a gentle suction. This is will increase the production of the collagen, improve the blood circulation, whatever the school and let the skin to breathe very healthy way. And the female will see, especially because this program sometimes once a week, sometimes every 3 to 4 days to do the session day after day. We have a lot of the what you call here the cosmetic hijama or cosmetic cupping. But the most important, gentle suction, because we divide the face here and the three way, right, left, and from down to up. And this is we can make it redness in the session. But after session and session, the lady is glowing in the face.
Okay, so ageless face.
Yes,
with hijab.
darkness of the eye will become less. Softness of the eye will become
With the dry cupping.
with the dry
Mashallah. Yeah.
static hijama treatment.
Yeah.
But the most important thing, again, I repeated, how to do the gentle
Technique.
suction.
Yeah. Technique. Technique, and sir, I think in this word, technique and diagnose. These two things are the most important.
Of course, because in this case, the question is very excellent. Because if the patient complaining of acne for gas or severe acne, and with some infected acne, how you will do this procedure?
Right.
Because you cannot.
Active areas we cannot do. Yeah.
We cannot. That means you need to first of all diagnose. After that, cure protocol. You start the procedure. And again, one important thing I want to share: not all the case same in hijama. You need first of all to diagnose.
Diagnose.
Then also the reflex. It's different from patient to patient. And as I told from the start, it's not a magic.
Yeah,
It's a type of a treatment held in the treat some patient
right.
and we can get a good result. And some patient came for hijama and not get any result. This is related to the body also, same as any type of treatment. There is a reflex from the body to the treatment. The most important thing, don't harm the patient.
Right, right.
In it in the professional way.
Exactly. So now let's move on to whom we have left over. The men's. So, sir, in male also, of course, they also have a lot of issues which are unspoken. So, especially on the sexual side, if I say, okay. So, for sexually and for also a male infertile cases, like how hijama can outcome.
You have some points, especially for that, especially in the lower back point. Yeah. This is concentrated for the prostate point. And this is will help to improve the prostate, to improve the ability itself, the erection and the life scope.
Okay.
Also, the sperm, it's the quality.
The
of the sperm,
quality.
it's improved. Because a lot of the infertility case, sometimes weak sperm, the motility is low, abnormal sperm is there, the number of the sperm is less. All this will improve by hijama, especially we are talking Torah if we have medical cause. Because some patient came to us, I have aspermia. Aspermia, there is no sperm, zero.
Okay.
Yeah. Of course, hijama will not help in this case. Because the production is zero. How hijama will help you? Hijama help in the weakness of the production. Any other type of the weakness, hijama will do a good effect, especially when we look as a treatment session between session and session 1 month, at least 3 sessions, or sometimes we reach 6 sessions. Also will bring a good role in the hormone.
Hormone.
Yes. The hormones, especially talk about pituitary hormone, pituitary gland, and the sexual hormone. Hijama will do a good effect of that. Because that also in the male, hijama will play a role.
A role. So the same thing again, it's coming back to back is hijama is helping in a treatment.
Yes.
That's a very important.
You cannot say treat, doctor. There is no any paperwork or any research said hijama 300%. Yes, I'm agree some paper shared last 5 years about the cholesterol. Hijama will treat cholesterol.
Cholesterol.
Especially when you are covering the hyperlipidemia, hyperhidrosis, and you do the procedure. Yes, I'm sure hijama will help. And the headache and migraine.
Headache and yeah.
They are very good.
I have headache every day.
I told you 100%. I'm sure all that you'll see the difference. Okay, this is 100%. Of course, again, we'll go to the same point, the reflex between patient and the patient. You complete your protocol and to avoid some food also during the treatments, the chocolate, nuts, and some cheese and mozzarella cheese, cheddar cheese, and mozzarella cheese. This is we have a lot of the oil of this some
Right.
food. This is will need sometimes vasodilatation or vasoconstriction in the body. This is will affect attack of headache. Not hijama will be
But all the things which you said is very tasty.
hijama. But getting the people all like it. Back all this people is like it. If that will try, we recommend it to us all and we'll see the difference. Especially when we stop it for 3 months.
Yeah.
Because to be honest, in this matter, the headache is a very severe attack and very difficult to the people sometimes to relate to the headache.
Yeah.
I cannot work, I cannot do anything in my life
Exactly.
all the time. I'm stressed because I'm facing a pain, especially sometimes I woke up with the pain. Because that when we do it, hijama protocol and helping to the patient, I should really appreciate about that. Because no anyone in the world know about unless the patient itself know about the severity of the pains in the headache.
In the headache, right? So headache and stress can be a part of this. Like hijama can be the major part of
Yes, we should be
headache.
choosing this to the stress also. As you told me,
Right.
diagnosis and you choose the part. Choose where I will choose the part. Rubbing not only in the back, of course, the back is a starter, but you have in the back, in the shoulder, in the abdomen, in the head, and the extremities, upper and over. I have a lot of the points. First of all, you need to play a nose, then you choose your point,
Right.
then
Yeah.
you do to call, then you see the
Exactly. Sir. What is your opinion in hijab, like hijama's future in in a modern healthcare?
You see a lot of doctors, first of all, interested about question from my center and how I train the doctor to every month. Now I have course to train physiotherapists, and the nurses, a lot of relatively suspicious. This is nowadays maybe last 5 years, there are more than 500 practitioners. This is a good idea or a good alarm or a very good I think that Hijama is very well
Yes.
listening about to learn about because we get a result to treat the patient. And that is for me one of the big benefit of hijab since the last 5 years. Second, regarding the some research of hijab part of some university around the world, they started with the hijama in the medical way and how to integrate with the modern medicine. The third, the patient itself.
Yeah.
That is done. As I told you before, when we are treating the patient and the latency level is on, if the patient say minutes for 5 years back and we got a lot of procedure to get conceived between the both partner. After that, when we do the hijama within 3 to 6 months, mashallah, the female coming pregnant. The patient itself is very loud.
Yes,
Right?
yes, yes. They're very happy.
Yes, I'm very happy. This is what we are thinking. Those good points for result to the patient itself and the patient feel very confident about the hijab.
Hijab.
The most important thing, again, I come into this point, don't argue to the patient by hijab. If your first intention, how came, sometimes with a scrap. And since 10 years back, you do hijab. This is kind of professional way. You need to do it 45 degree. And the very gentle scratch
Yes,
skin,
absolutely.
it the president.
Yes, I have seen that in your classes because I'm a student as well. So according to what you have taught me, actually changed the perspective
Yes.
of hijama in my life.
Yes.
According to me, hijama was what I got is ki haan, we have to do a lot of massage. And then we have to keep the cup for at least 10 to 15 minutes, then scratch it and see and get nervous. Oh my God, blood is coming or no? Why is it not coming? It was a target for me. But the day I stepped in your class and I realized that what hijama I need is totally different than what you are teaching.
This is the true concept of hijama because we cannot do it like that. We do it 2 3 minutes first of all. Oh, of course, I agree with you. Some schools said we can do it sagittarily first. We'll bring the cup and we make
Just slightly.
activate the blood circulation for just a minute.
Okay.
But generally, in sterile, we put the cup for 2 3 minutes. After that, we try pinching very gentle pressure again to remove some amount of blood. Resuction, then make it resuction to reactivate the blood circulation. And after that, we remove as sterile, we covering blister and bacteria. The procedure is a lot of the very easy procedure. Will not take it more than 10 minutes on the start of the sterilization, but you need to choose the way of treatment, the roller bone, the procedure way to treat the patient, and then we'll get the result from the body because, as I told you, need to do treatments.
Yeah. So I think that is the reason people who know about hijama,
Yes.
they take hijama as a help in their life. Like athletes, they feel so active after hijama that they are able to perform much more better what they have done it like in a normal.
Yes. Why? This is the question mark. The most important we told increase the oxygen outside the muscle. We remove the lactic acid.
Right.
We remove the non-organic phosphorus. This is all will lead to activate the blood circulation and they activate also the oxygenation to the muscle. Then that all the sport people who's playing again in feeling more power. So, and also it help in the injury,
In injury.
especially in the recovery procedure. Whereas now a lot of the big club in the world open hijama clinic inside the club itself.
Oh wow.
Yes,
See, this hijama helps in recovering the injury of sports injury.
of course. But like what minute to hijama with the business.
Yeah. That is
I need to know what type of injury hijama will lead.
Yeah.
This is in the tier. If there is tier, on the tier. Hijama will not help, of course.
Yeah. That is the healing.
Yeah. So with that, you need also to integrate when you can integrate hijama with the injury itself. Because that also people is nowadays a lot of hijama also because the knowledge of the hijama is niche. A lot of the knowledge, a lot of the people information about the hijama. But of course, you need to share some important things. You still have less information. Use the hijama. This is lead to a very bad information sometimes because that's some of because still until today this is against because the misinformation about the hijab.
Okay, so there are people who are still against hijama, but hijama, I feel I have personally seen patients feeling that. Yeah, I had a patient, sir, she had wheezing. Okay. I did hijama for all the points, and the next day I got a message from her that, Doctor, I didn't wheeze anymore. So it was like, I feel so happy, and I feel that, okay, we made a person's life better. better.
Who's that? The irrigation make the conference. The potential. Pajama, you see the result after that patient to patient see the benefit of pajama. Because as I told you, helping in the sleep. An autoimmune disease like MS, multiple sclerosis, a lot of people complaining of headache and back pain, shoulder pain, neck pain, and general pain. When we do the hijama as type of the life, and we need to do it continuous, long life, especially after finishing the first course, the patient could call you or send you a message, I'm feeling better. What the meaning of feeling better here? Symptoms decrease. But this is the most important thing, and this is what I'm looking for to improve the health of the patient, increase the toxicity, increase the symptoms. Patient life will be more better.
Right, right. So, sir, I have seen scrolling in Instagram and Google and everywhere. I have seen that Ronaldo has done hijama. Like, there are many.
Many athletes were hijama, especially talking about football. Player like Ronaldo, like Mark, Zena, because as I told you, this is like now they is not coming as a partner or
Right.
friend. No, it's coming because we help the health of the athlete, human
The power to increase.
power increase, as circulation improve, the energetic to the muscle itself is because that nowadays, as I told you, a lot of the club around the world interested to open like a branch of hijab
Yes.
physiotherapy.
Yeah, that's a very good news. When I got to know that physios are allowed to do hijama in UAE and they have the license. So it was a pleasure that, wow, we can help somebody much more deeper. Much more deeper.
To be honest, there is no country around the world like United Arab Emirates how to support complementary medicine and how to integrate hijabs also and the put pajama in the professional way. Ministry of Health and United Arab Emirates would a big job in this matter.
That right. My last question, sir, will be there are many patients whom I have visited and I've got the query. I want to do hijama on my head. So, they push people think that head hijama is for migraine or is for stress. But I think that is again a misconception.
No, we can do it.
Yeah.
Of course, we can do it. Pajama in the head is a type of treatment, surgery in the head. Look, it's not a misconception. But we have some point in the back of the head.
Yep.
This is all point 39. You not recommend it to do this pajama point or repeat it. Or we can do it once a life because maybe it will help or affect concentration itself in the memory will decrease. Because that we avoid this point because that's what we are doing. But of course we can do it any and we have a lot of the point
Once,
the head, occipital area, back of the head and the back of the ear, uh, helping in the treatment of the headache or migraine or some other disease like Parkinsonism.
Oh my God. Yeah.
We can help these patients, some patient also of tinnitus, ear problems, some patient of also general neuralgia, facial ulcer. Like that, we can add it.
Right. Hijama, I see hijama's future is amazing outside. Inshallah, inshallah. That's such a So we can do hijama on the head. That is 39, but it is once a lifetime.
Yeah, I'm not do that also the patient. I have to only because we have alternative point and had like 32, 01, 34, 35. We have a lot of the points you can add.
So you do hijama too for yourself?
Yes, sometimes once a year. Especially when we do it my t-shirt when I'm going travel to Canada or something like that. There he recommend to do it at least one once a year. At least.
So I should start doing hijama. Definitely. So it was a pleasure having you here with us, and thank you for sharing such a beautiful, informative things about hijama, which will help. And I really see, inshallah, hijama is going to be a great help.
Inshallah, inshallah. Thank you again for the good trust and always support.
Thank you so much, sir. Thank you so much.